other side of that is that they're living longer with chronic conditions. And one of these is cataract. And people are being treated for cataract now with implant lenses, which is a good thing. But none of the implants can actually mimic exactly what the real lens can do. We can certainly improve the design of implant lenses, which is what one of our projects funded by Fight for Sight is all about. It's looking at what the real lens is doing, how the optics of that is changing, and we found some very interesting, intriguing bits in that people have never seen before, that we can then use as a model for implant that enormously improves the quality of life of a person. A lot of the things that are taxing societies, and not just in the developed world, but increasingly in the developing world, is how to maintain healthy aging. Because modern medicine now has reached the point at which they can maintain a lot of people with chronic diseases, but curing it is quite another thing. So more and more now we should be focusing on the quality of life, how the older person manages. And one of the things that is probably the most difficult to deal with is sight loss. If you lose your vision, or if you lose aspects of your vision, it's a lot of adjustment that's required. So I'm very interested in looking at from two sides of it. One is looking at how to improve the visual quality of people who've had cataracts and have implant lenses put in, because cataract is an aging disease. As people live longer, more and more people will have cataracts, and at the moment there is no cure. There's only a way of removing the lens and putting in an implant, which is the only treatment we have. The other side of it is, of course, how the person with visual impairment copes in the world around them. A lot of people spend a lot of their time at home, particularly older people. And if we could adjust that environment, that internal home environment for people, to optimise it, to make it better for them with any sight conditions they have that can't be treated, then we're doing them a big favour, because what we're doing is we're increasing the amount of years they have of independent living. And most people would like to stay in their home. So we're also working on an ambient assisted living project funded by the European Union, and we're looking at how we can improve the way that the internal environment is arranged, how the light falls on various objects, how we can play with shadowing, all that sort of thing, to make sure that we can optimise the vision that a person has, so they can focus well, so they can maintain their quality of life in an internal environment and living independently.